Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about the virus known as monkeypox and the disease that it causes, known globally as Mpox. Most people probably hadn't heard of monkeypox virus before 2022, even though it had been identified in Denmark in 1958. At that time, the virus was found in monkeys housed in research facilities. It wasn't until 1970 in the Democratic Republic of the Congo that it was determined that monkeypox could cause disease in people. The first person diagnosed with this infection was a 9-month-old baby. If we fast forward to 2022 and awareness of the virus becoming more global, this happened because the virus had changed, allowing it both to more easily spread from person to person, as well as changing some of the symptoms. While spread in the United States has slowed since 2022, the virus continues to cause small numbers of cases in the United States and more cases in other parts of the world, particularly in several countries in Africa. During the next little bit, we'll talk about the disease caused by monkeypox virus, the vaccine that prevents the disease Mpox, some questions that we get here at the Vaccine Education Center, and the relative risks and benefits of this disease and vaccination. So let's get to it. Now, monkeypox virus can spread in a few different ways. Most commonly, it spreads when people come into contact with either the bodily fluids or the fluid from lesions of someone else who has the infection. But it can also spread when people come into contact with virus on objects, like something that was used by an infected person, such as clothing or bedding or towels. Generally speaking, however, that's a less common route of infection. On occasion, pregnant women can also spread the virus to their unborn babies, and sometimes that infection can result in fetal death. And finally, people can get the infection from infected animals if the virus is spread from the animal either through a bite or a scratch, if somebody eats the meat of an infected animal, or if someone's handling infected animals or their carcasses. Now, people with Mpox can spread the virus from about 4 days before their symptoms until their lesions have completely healed, meaning that a new layer of skin has formed over that area. Notably, there are different strains of monkeypox virus that are commonly called clades, but infection with one type usually protects the person against infection with all types. So even if somebody develops a second Mpox infection, it's likely to be less severe. While some people have no symptoms, others develop symptoms like fever, fatigue, headache, weakness, enlarged lymph nodes. And then a rash usually develops shortly after these symptoms appear. And it can occur anywhere on the body, but most often the lesions appear on the face, the arms, and the legs, and particularly on the palms of the hands or the soles of the feet. When the lesions develop, they look like blisters, but notably they can extend deep into the skin. So they tend to be painful, and as they heal, they tend to be itchy. The sores can last for about 2 to 4 weeks, so you might quickly realize that people can spread this virus to others for a relatively long period of time. Now, some people will develop more severe symptoms or complications, and this can include things like painful lesions that appear in the mouth, genital area, or anal area, and that can limit the person's ability to eat, urinate, or even have a bowel movement. They can get infections of the muscle below the skin due to the depth of the lesions, and that can cause cell death in sections of the affected muscle, and it may require specialized wound care, such as we would normally see burn patients being treated. They can also develop inflammation of the brain or the heart, or they can develop ulcers in their digestive tract that cause a narrowing of those organs that digest our food. Some people get bloodstream infections. This is commonly known as sepsis, and they can also experience excessive bleeding called hemorrhaging. People who are immune suppressed are more likely to experience these severe complications. Now, the groups of people who are considered to be at highest risk for Mpox include people who are healthcare workers, Others who might come into contact with the virus through their job, such as people who work in labs, first responders, and environmental services workers who work in places where infected people are commonly found, such as in healthcare settings. Another group is people who live with or are in close contact with infected individuals, including children in the home. People with multiple sexual partners, including men who have sex with men, gay, bisexual, and transgender people, and sex workers and their clients. Okay, so let's turn our attention to the vaccine. The vaccine that's used for Mpox can also be used to protect against other orthopox viruses, including smallpox. However, the vaccine, called JYNNEOS, is currently only recommended for people at high risk for exposure to these viruses. And since smallpox doesn't occur anywhere in the world, and monkeypox infections are fairly limited in who is at risk, the vaccine is limited as to who is currently recommended to get it. Now, the vaccine is a live weakened viral vaccine, but it is unique from other live weakened viral vaccines like those for measles, mumps, rubella, or chickenpox, because in this case, the vaccine virus has been changed so that it can't replicate once it's in the person's body. The vaccine is given as 2 doses separated by 4 weeks. And if somebody's at ongoing risk for exposure, they may be recommended to get booster doses. Now, the vaccine is typically given as a subcutaneous injection, meaning that the injection goes into the fatty tissue rather than the muscle, like many other vaccines. And sometimes it's given intradermally, meaning it's given just under the top layers of the skin. Now, the subcutaneous injection rarely leaves a mark and tends to be preferred for people with skin that's prone to developing raised scars, but the intradermal approach tends to be less painful. However, that approach can often leave a mark, and the side effects tend to be more severe when the injection is given right under the skin. Now, there is a second vaccine to be aware of. It's known as ACAM 2000, but this version causes more side effects, so it's not currently recommended for use. It is, however, part of the U.S. stockpile, so in the event of a bioterrorist attack using smallpox, we could find this vaccine being used under that kind of a circumstance. The side effects that can occur following receipt of JYNNEOS include pain, redness, and itching at the vaccination site, and a small number of people could have an allergic reaction to either the vaccine or a component of it. Some people will also experience other more systemic side effects like fever, headache, tiredness, nausea, chills, and muscle aches. The original studies of JYNNEOS were small, but they suggested that about 6 to 8 of every 10 people would be protected at least 2 weeks after getting both doses. Larger studies with more diverse populations are continuing to be completed. So let's talk about some of the questions that we get here at the Vaccine Education Center. Some people reach out to ask where they can get this vaccine, since many providers do not carry it. Generally speaking, availability varies by geographic location, and the vaccine may be more commonly available in larger cities. However, we typically recommend that people check with their healthcare provider first and then check with their local health department to see where they can get vaccinated in their area. Another question we get is whether the vaccine works after exposure. And the answer to this question is yes. People can get vaccinated before or after they're exposed. However, the vaccine should be given within 4 days of exposure. Because the vaccine is approved for use in people 18 years and older, sometimes we get questions about whether children can get this vaccine or whether it can be used during pregnancy or breastfeeding. Now, adults who are pregnant or breastfeeding who are recommended to get the vaccine can be given this vaccine. For children, JYNNEOS is approved under Emergency Use Authorization, or EUA. Now, this was an important use of EUA because when the virus started causing illness in the United States back in 2022, the vaccine hadn't been tested in children, but there were some children who were being infected, mostly because of close physical contact with household members, particularly in younger children less than 12 years of age. And we did see some adolescents also having exposures from more intimate male-to-male contact. So it was important to be able to use this vaccine even though the testing hadn't been completed. So let's finish up with a quick consideration of the relative risks and benefits of vaccination against Mpox. Most people in the U.S. are not routinely recommended to get this vaccine because at this time most people in the United States are not at increased risk. However, some groups of people are at greater risk based on either their occupation or their lifestyle. And for these people, it's important to realize that the side effects of the vaccine are mild, and the disease can cause some fairly severe symptoms and complications. In particular, it can cause painful, itchy lesions, can lead to open sores or deep muscle lesions that can require specialized medical treatments, such as that given to burn victims. And sometimes people can develop painful lesions in mucosal areas, like in their mouth or their genitals or their anal area, or even in their digestive tract. And we've seen cases in the digestive tract where those ulcers can cause a constriction of the organs that digest food. People can also experience bloodstream infections known as sepsis or hemorrhaging. And on rare occasions, people can die from their infection. For these reasons, if someone's at increased risk of infection, when our team evaluated the relative risks and benefits of this vaccine, we felt that the benefits outweighed the risks for those people. And we hope that once you've had the chance to review this information, you'll feel that way too. Thanks for listening today.